working tirelessly to push through mental health legislation that could help families deal with troubled loved ones before tragedy happens. It has been stymied virtually every step of the way. Joining us now is that Congressman, Pennsylvania Representative Tim Murphy. Tim, you and I have come to be friends over this issue, and I'm sorry to once again be having the exact same situation that brings us together all too often. What can you tell the American people about what common root causes are in these mass shootings, at least, and what we are not doing right now to help stop them?
What we're not doing is, and this comes from both the executive and legislative branch, the slow, snail's pace approach to dealing with serious mental illness reform. It gets pushed aside and say, let's look at this another week, another month, another year. And in the 3 years I've been working on this, hundreds of thousands of deaths from suicides, drug overdoses, homicides, the slow motion death of homelessness have all occurred. Here's what happens. We have a federal government which has policies that towards serious mental illness, quite frankly, are abusive and neglectful. And what is worse is they're even more discriminatory towards those who are minorities and in poverty. We have a federal system that is more interested in protecting people's rights to be sick than their rights to be well. We have a criminal justice system that is more interested in putting people in prison than getting them hospital beds. We don't have enough providers. We don't have enough places for care. We spend and waste billions of federal dollars on absurd programs like making collages and buying paintings and having websites with sing-along songs, and refuse to even acknowledge that schizophrenia and bipolar illness exist. And then what happens, because you have folks out there saying they don't want anybody to ever be involuntarily committed, you end up stymieing those laws which say that if someone is seriously mentally ill and propensity towards violence, because they don't have an involuntary commitment, they can still purchase weapons.
Well, let's take it one step at a time.
This picture?
The first thing they say is, not now, Tim, not now.
That's right.
Let the blood dry. Be there for the families. Let's know all the facts. Don't politicize this. You say what many say, and increasingly more are saying, which is, no, now is exactly the time. Explain that to those who say you're wrong.
Precisely. You know, Congress will probably have another moment of silence when we get back next week. And I, like many Americans, will be sitting there extremely frustrated saying, we don't need silence, we need action. And if Americans want to do anything, they ought to pick up a pen or go to a computer or pick up their phone and call their member of Congress and say, move this comprehensive mental health legislation, H.R. 2646, the Helping Families in Mental Health Crisis Act. Because once again, Congress will say, you know, we've got other priorities to work on. And again, I put blame on both sides of the aisle, on leadership from top to bottom, who pushed this aside. What we have to understand is, instead of talking about, well, maybe we ought to think about this more, maybe we ought to compromise more, these families of the victims, they're hurting, they're in pain for the rest of their lives. They don't want any more people talking about compromise and putting this off. They need action now.
They say,
and so I hope Americans speak up.
The families say, don't let this happen to anybody else. The advocates, many health care advocates, specifically mentally health, the mental health part of health care, say, whoa, don't paint all mentally ill with the same brush. Don't take their privacy rights. What about the HIPAA laws? You can't tell people to get treatment. We don't want their records out there so that people could review them. We don't want some bank of information that the government has with your mental health. We don't want any of this, Tim. Don't take us down this road.
Well, and you know what? My legislation, nor any legislation, is going to take us down the road to take away people's rights to privacy. But when you have federal laws that are set it up that actually prevent families from helping and then blame families for not helping, that's perverse. When you have federal laws which say that family members can't know when someone has an illness, when you have colleges that are more worried about being sued than notifying family members when there's a problem, when you have federal agencies that specifically pay for groups to go out there and take people out of hospitals and then block them from getting help, that's the perverse problem. My legislation, supported by the American Psychiatric Association, the American Psychological Association, the National Alliance for Mental Illness, Mental Health America, many programs out there doing this. Congress has to get off its duff. The White House has to be willing to work with us and deal with this comprehensive problem. Look, America, we should all be incredibly frustrated, but don't just be frustrated. Be vocal and tell Congress to move this legislation.
Who are the obstacles? What are the obstacles? How can we ask questions to those who are stopping this process to see what it is that's motivating their recalcitrance?
Well, the recalcitrance comes, I think, from a lot of times from lawmakers want to do something but not really understanding. So if someone says, gee, you know, we don't want to take away someone's rights to refuse treatment, I don't want to take away their rights either. But they have a right to be well. Families have a right, whether it is here in Oregon now or the issues in Connecticut or California, those families had a right to see their children grow up. And those who were still alive, they had a right to go through life without dealing with trauma the rest of their life. That's where Congress has to hear the voice of the American people and saying, stop squandering the opportunity, stop delaying, stop letting more people suffer in this. That's the key. America needs to speak up.
Well, let's use an opportunity that is about the worst of us and use it as an opportunity to bring out the best in us. Let us know when it's on the hearing docket again so we can cover the hearing, we can see what the resistance is, and we can let people weigh in. Representative Tim Murphy, as always, it is good to hear your voice. I'm sorry it is on occasions such as this.